all the wonderful work that's been done in nursing. I'm here to talk to you about nursing leadership programs and in the future. And what I'm going to talk about is how we can use the drivers that we have and also the work that's been doing as a result of the pandemic to prefer to forward nursing leadership. Oops. So I'm going to be talking to you about nursing leadership programs, where we are now, how the impact of the pandemic, the drivers for success, and how that works practically. So a bit about me. My name's Dawn Jarvis, and I recently worked in the NHS. I am now currently working as a consultant. I have experience in program management, I'm a motivational speaker, and I'm a nurse entrepreneur. I also have experience in as a program director in maternity, children and social prescribing, and I've worked in the workforce with Capital Nurse in nursing leadership program as a nursing leadership program director. So, what are the policy drivers for nursing leadership? What are our drivers for action, and what are the policies? Obviously, we have the NHS long-term plan, and we've had the interim NHS plan, and we've also had a document that's been produced this year saying we are the NHS and the people plan and 2020 with actions for us all. And on top of that, and to support that, we have our NHS People Promise, which has set out some actions for all of us in the NHS and what some rights and some expectations that we as employees and employers can expect from the NHS. And so for nursing, as a result of the NHS People Plan, there are some drivers for action, and there are some actions for both employees, for systems and for national bodies. And they are around retention, health and well-being, recruitment, flexible working, growing our workforce, equality and diversity, new ways of delivering care, and culture and leadership. And those actions are around, particularly around culture and leadership, or there are some expectations from us around, how are we going to retain our workforce? How are we going to develop our leaders? How are we going to support our employers to be inclusive and supportive and confident leaders? There's an increased focus on equality and diversity and the impact that protected characteristics can have on our work, on our populations that we serve, and on our services. And that is what is driving the action that we need to do. I think it's a really supportive document, and I think already people in employers are looking around the actions and how they can demonstrate how they're working towards those actions. So, what is the impact for nursing? What does that mean practically, and what are we committed to doing? So, we're committed. So, the manifesto for the current government was around delivering 50,000 more nurses, and there was a commitment in the long-term plan, in the People Plan, to increase the number of nursing placements by nearly 6,000, and to increase the number of nurse associates and also to look towards our international recruitment of both doctors and nurses, and there was also recruitment to retaining, and there's a number there of 12,400 nurses. And as well as that, it's around retaining nurses. So there's a commitment to slowing the leaver rate from our providers and from healthcare organisations in primary care, in secondary care, and also from clinical commissioning groups. And there's something around, how we're going to work more as a system, and how we're going to work not necessarily in silos in individual organisations, but how we're going to work across systems and nationally. So it's been an incredible year. It's been, this has been said so many times, like COVID-19, it didn't come from nowhere. We did know that potentially there was going to be a pandemic, but this is where we are, and the impact has been great on the NHS and, for our populations and, for our staff and for our patients. I've written down here sort of the impacts, I guess, for nursing. So there's an impact on our services, both in primary care, access to health, there's a capacity within mental health, and, people be able to access them. There's a drive towards technology that may disadvantage people with protected characteristics, or and there's the disproportional impact of COVID-19 has had an impact on race equality, not only accessing services, using services and responding to health messages, but also with the demographic of the nursing and the NHS workforce that has had an impact on being able to deliver services and staffing. Nurses predominantly are female, and that has had an impact as well. And one of the impacts around sort of on particularly when they've had, the impact of COVID-19 that may have been in their family, may have been themselves. My mother was in hospital for 4 weeks with a ventilator with COVID-19, and it was a really difficult time because I wasn't able to visit, and I just wanted to sit there and hold her hand really, and I wasn't able to do that. And I suppose the impact has been around, potentially for nursing is around burnout, around, difficulty recruitment and retention. There's also the implications of staff sickness that I know that people are feeling, and all protected characteristics have an impact on that. And I think that the impact of all of this is going to influence how we move forward, sort of with developing leadership and supporting our staff in the NHS. So what's the challenge? What do we have to do? And I think moving forward, I said earlier that the challenge is around, how do we, with policy and with the current, the way we have to work in real time, how do we take those things forward? And I've sort of had a slide here about, the challenge for leadership and for nursing leadership is around, I suppose, enabling effective team-based working within and across traditional organisation and sector boundaries. And I think that is a clear message from the policy documents. And I think there's new ways of working. Now, COVID-19 has been terrible. It's been an awful thing, but it has driven people to work differently. I was doing a project last year around working more with digital, about doing video calling and conference calls, and there was quite a lot of reluctance to do that. However, when COVID-19 happened, it happened in a week. So, I read somewhere that things that have taken 15 years have happened in 3 days. So, that's one of the advantages of, having a pandemic, not that you'd want that, but innovation and different ways of working, different ways of delivering care is one of the results of the COVID-19 pandemic. And also, there is an increase in evidence base around the positive impact of collaborative and compassionate leadership, but then that's to enable health and care staff to do their best work. So, there's obviously a moral case for that, but there's also the business case and the sort of outcomes with patient care and the delivery of services. So, what does an aspiring nursing leadership programme look like? I did follow a leadership program. I was part of the Breaking Through leadership program, and I also did an Aspiring Director program, and that program was directed at at people from a black and minority ethnic community. I think, and that was a brilliant leadership program. I learned a lot. I networked, and I made a lot of friends, and she was able to strategically plan my career. And I had a portfolio career. It wasn't traditional, but I was able to do that and to do that successfully. And that's what that program did to help me to do that. But I also had to do a lot of work around that. So I now, where we are now, I have an idea that we should have sort of a portfolio approach to leadership programs, that we shouldn't necessarily, we obviously, leadership programs that are developed, as standalone are wonderful, and leadership programs that are for particular, people from protected characteristics are also good. But there's also something about, once you've done a leadership program, how are you supported and how do you go forward? Okay, so this is sort of my idea about sort of portfolio leadership programs, and I'm hoping on your left-hand side that there's some ideas around, how do you develop them? Well, you look at data, obviously, the strategy and the policy planning is around, why you would do that, and as I've said before, it's around, how systems work together to implement that strategy together, and it's not a standalone thing that you do. It's part of the whole, the health economy and how you deliver services and how that reflects with your staff and how to deliver services. Stakeholder management is obviously key, and it's not just about nursing, it's about all clinical professions and all people that support the delivery of care in the nursing work in NHS and in healthcare. And I think that there should be sort of a program management approach. I know there are national programs that are looking at retention and recruitment and international recruitment, and it's around how the support and the resources can be sort of like disseminated down to a system level, but also in individual organisations, what does that look like for them? And from a quality improvement point of view, that's one of the enablers to do that. So here I'm talking about enablers, sort of like, the primary care networks, models of care, interprofessional working, and how we would do that. Matrix working is obviously very important, and I think there's a real role around leadership, that it's not about positional authority, it's about how you work through people. I think also there's things to be said about role design and flexibility and the traditional ways that how you become a nurse, how you qualifications, regulation, and around that. I said, it's around engaging with management and with staff around what that would look like. Nursing leadership, and there's obviously a thing that and the sort of like the threads of equality and diversity and health and well-being are really, really important, and there's a real drive to support BME work streams and other other sort of staff groups and patient groups as well. I'm just going to go back to the last slide and talk about, what does that look practically? I have been doing work, I'm currently doing work with, because it's all very well, these policy drivers, but what does that look like practically? And I think it's very difficult to sort of, and I think the will is there, nobody goes to work to do a bad job. I heard someone say that yesterday, and it's very, very true. And, there is a will to help people progress, to help people support leadership, and also to help employers to be inclusive. I think I'm currently doing some work with an organisation around supporting the black and minority ethnic network around their feelings around COVID-19 and how that affects them and the way they work and the implications for them on the front line, and how they package that, and so that their voice is heard at a very senior level. And that work is interesting because and I really congratulate the organisation because they are really listening to the staff voice and they're offering support. However, there is, that's a difficult cultural journey to make, and it's not just about the BME network. It's also about managers, HR and whatever that need to sort of like have that conversation, and maybe to have difficult conversations about lived experience and what it's like for them. I also advocate that people need support to be inclusive. They need support to be inclusive managers, and I think as well as sort of designing support for protected characteristics for nurses and whatever, we also need support sort of like mid to senior level management to be supportive. I think coaching and mentoring is really important. I'm currently working with a nurse who's just gone into a leadership role. And I think when you're working at the front line, it's very different to being a ward manager. And, it's a totally different way of working and what to expect and how to do that well. And I think as we move people into leadership positions, that's what we're doing. So I'm advocating a sort of blended approach to leadership programs, sort of supported, programs that are really, really good, coaching and mentoring, support from your manager around career conversations and what your expectations of your career pathway, retention initiatives around, what's going to make you not leave the organisation or nursing and stay in nursing. And I think that's the work that will become increasingly important, especially in the times of a pandemic. Thank you very much.
Great, thank you, Dawn. A really, really important area that we want to help to promote. And obviously lots and lots of information in there. So really, really good. A reminder to the audience out there: please get your questions in for Dawn. And as ever, I'll kick off with some as we've got a few minutes to have a chat, which is great. I guess you mentioned the important thing there. I mean, I think that's a really, really key one. I mean, have we got that right? I suppose is what I'm thinking. Does it need to be? Is it formal enough or is it informal enough? Do mentors need training themselves? That sort of thing. I mean, because it does feel like such an important area. People mention it a lot as an important thing. It's helpful.
Yeah, I think people mention mentoring and coaching in the same breath. And one of the things I've learned in sort of starting sort of a coaching relationship with people is how much of that is actually mentoring. How much am I using my own experience of having being a nurse and being a sister or ward manager to sort of help and guide. I think people do need support to do that. I mean, I remember there's a lot of work that's done when students are coming onto the ward and how you support them. And I think, if we want to support our nurses to support students, then we also should be supporting our nurses and our leaders to support nurses leading who want to are aspiring and want to move through the profession. One of the things I've recognised and learned in the last few months is, are we really clear about what our jobs are? What are we here to do? What are the signs of success in our job? So if you are a Band 7 ward manager, what at the end of the year, what does that look like? How will you know you've been successful at the job? And I think what happens generally, people get a post, they're very excited about it, and it's like, oh, then what? And I think in interviews, I've been asked to interview questions. So what are you going to do in your first 90 days? And I think that's something to be thought about, sort of when you start a new post, what are you going to do in your first 90 days? Is it going to be firefighting? And I've had experiences of people where, yes, that's exactly what it is. It's particularly in a pandemic situation. There are new things that need to happen. But then I've also had the question, I've got to go to a quality meeting. What do I say there? And I think I've always said that, no one teaches you how to be a senior nurse. No one teaches you how to be a manager. I think I know, and I hope that that has changed sort of in the preparation for nurses now. But there's something around, watching what other people do, role modelling. I know in the people plan, in the actions, there are things around competencies at particular levels, at board level, at, fit and proper people tests. So I think that's sort of part of the continuing development that we should be doing, that doesn't necessarily need a course, but sort of needs to be sort of a pathway, if you like, of, how you progress if you want to. And you don't have to be a manager, you don't have to be a leader. I mean, we are all leaders in very different ways, but if your pathway is around specialisation, that's also good, but how do you, I think people struggle, and I've heard that what am I going to do? What's the best thing to do if I want to be a CNS, if I want to be a specialist in something, what should I do? And I don't think the pathways are that clear, and I think that people can be supported to do that, but I also think that people who are supporting need to be supported, if that makes sense.
Yeah, perfect sense. Yeah, absolutely, no, great answer. Yeah, I mean, I don't know whether you heard, but one of our speakers earlier was actually she's the author of the Matron Handbook, in fact. So that's
yes,
one of those,
yes,
what we say, is
yeah,
starting to get
and
stuff in there.
and what that is a wonderful resource, and they have a ward manager's handbook, and they have an executive nurse handbook. It's around how people are supported to enact those things. They are brilliant documents, and policy documents. All those documents are fantastic. And for me, what does that mean practically? What's the offer that we're offering people who are either ward managers or aspiring ward managers or aspiring matrons? I really liked what was said around, if you want to be a matron, have a look at this handbook, because that will give you some keys, and also it gives you some keys around what a matron expects of you. So I really like that, but it's around making that a practical thing and a transparent thing, and everybody knowing about it. So the only thing I would say about those handbooks, how accessible are they? Are we using them strategically? Does everyone got access to them? And and I know there are plans to make all sorts of leadership programs digitally and available to everybody, and I think that's very important.
No, absolutely. So you mentioned how the pandemic had changed the landscape for leadership, and the fact that projects were turning around quicker, and things like that.
Yes.
So there have been some positives. I mean, do you think they're here to stay now? Are people going to keep those things in place, or is it just the fact that there's a pandemic that people have just worked together better and shown a bit more leadership? That I don't know.
I think the pandemic has shown that Burning Platform is a great lever for change. If you've got a burning platform, people will do something or die, so literally. So that shows that. And I'm a nurse, great operationally, if there's an emergency, cool, we can manage it, we can do it, and we have done it, and have managed everything to the best of our ability as a profession. However, it's I guess it's using that as an example of what can be done, and and then not letting the impetus or the momentum to go. So if you can change your model of meeting, rather than driving potentially 100 miles, spending 2 hours in a meeting and driving 100 miles back, to then being able to do it by video, and you can do that in literally a day, what is possible. And I think it's about the art of what is possible. So I think the pandemic has shown us what is possible, what you can do, the resources that you can marshal if you want to, and I think that we should use that as a enabler for change. In that, and when sponsors of programs and projects, that sort of like, their job is to sort of like remove barriers. So the pandemic has shown, when you need to, you can remove any barrier. Almost any barrier you can, so there's things about procurement that was a bit more difficult, but there's some lessons to be learned there, but also.
Absolutely. Great. Okay, we've got a question in, and this is from Grace. Grace Farahinmi. Sorry, Grace, if I pronounced that wrong. Anyway, so your question is, why do we not have any support or pathway for research nurses? So that's one specific to research. I don't know whether you know the answer to that.
Well, I think research is really interesting. I would say that research was something that frightened me when I was a frontline nurse. However, if you do programs around quality improvement, you are doing research. I did a project where we were looking at best practice, and that is research. And if you're looking at qualitative data, if you're looking around patients or staff responses and that they give and the feedback they give, the way that's collated, that is research. So I understand, I think with it, there is always a call for specialisation. And I think, yes, there should be some, sort of a pathway to working in research. However, I think that research is part of all of our work, and that we are guided by research. We are guided by patient experience. We are guided by staff experience. And, we can research the outcomes of our initiatives. So, yes, I think there should definitely be some thought to do that, and I believe that initiatives like Capital Nurse are working with higher education providers around that, and around research, and around the pathways of care, and how you have those different pathways. But again, I think that we are all doing research, whether we know it or not, because we're all providing data.
So there you go, Grace. Hope that answers that, or helped answer that. Moving on, obviously you mentioned, well, we have been discussing how the pandemic has accelerated change in some ways and other things, and obviously it's shone a quite bright light on BAME staff and how they've been treated and things like that. Again, do you think it will accelerate improvements or lead to some hopefully lasting change in that area in terms of promotion, and it's such a complex area, but just some improvements, just generally?
I think there are policy drivers that have made that very important. Leaders, both of the NHS and, so Simon Stevens, Ruth May, have been very clear around the direction of travel that we should be going. Our policy and planning documents are really, really clear. There are also assurances that need to be given, through regulation around the well-led in the CQC around regulation about what should be happening, and there is best practice and about the way we should be moving. However, we are where we are, and we're not anywhere near where we should be. And part of and the People Promise and the actions around the People Plan are around initiatives that you should be doing to make that better, not only for BME staff but also for any staff with protected characteristics. And that is the right thing to do. I think, as always, the proof is in the pudding. It's really good that we have leaders who are saying the right things. It's really good that we have policy documents that are saying this is what should be happening. It's really good that that this has been linked to patient care and and results and outcomes. And I think the difficulty is how. What do you do, and what does that look like? Do you respond on a piecemeal basis? Do you respond on a system-wide basis? And I think that's the things that people are struggling with. Also, on a level, I had a conversation today with someone around a BME network, and it was a member of staff, and they was talking about how difficult it is to talk about this as a subject. And I sort of said to her, and it's the thing I'm keeping, is that if we were talking about a broken leg, it would be a different discussion. You know, it's a bit like the difference between physical health and mental health. You know, why is it different? But it is different. And I think there's a lot to be gained by hearing people's lived experience. You know, the way we do things at the minute doesn't provide a good experience for Black and minority ethnic staff, and those are the facts, and they're demonstrated in the staff survey. They are reflected in leaving retention and disciplinary, and you know, all sorts of ways. You know, the case is made, the data is there. So it's around, you know, how do you listen to people and what they're saying, and they're telling you that in lots of different ways, and how do you work differently. Also, I think there needs to be a conversation about having difficult conversations. I think there should be some support around that, because I think it is very difficult. You know, it's very emotive. Even having the discussion, it sort of brings up a lot of things for people, both from a Black and minority ethnic perspective, but also in the managers, because as I said earlier, nobody wants to do the wrong thing. But I think, as I said in the presentation, that I think people need to be supported to do the right thing and to have those conversations.
Such an important area. Such an important area. Would just be nice to be able to report some progress. But yeah, no, it's something we
There's a
really
lot
want
of
to.
good practice out there. There's a lot of good practice out there. It needs to be shared, and you know, and the levers are the policy documents. The levers are, you know, well led. You know, the CQC regulation. You know, there's a lot of policy out there. There's a lot of good practice out there that needs to be shared. But I think it needs to be acknowledged that this is very difficult. This is not easy, because if it was easy, we would have done it already.
Wise words indeed. So we're pretty much almost out of time. So thank you very much, Dawn. That was really fascinating.
Thank
Great
you.
to talk to you. Always a pleasure to talk to you. And our next session is with Louise Murray from NHS Employers, and that's on supporting the health and care of the workforce. So see you soon.